Thanks very much, Diarmuid. And I suppose what struck me today is the title of the conference, which I really like, Integrating Evidence and Action. And we're, I suppose, awash with evidence in relation to alcohol-related harm. Philip has mentioned some of them. I might just pinpoint one or two more. 1.5 million people in Ireland drink in a harmful manner, and 40% engage in heavy episodic binge drinking. So that's, I suppose, the prevalence of this problem. In terms of the impact, again, Philip mentioned it, the impact on the health services, 6% of presentations to the emergency department. So in terms of the key focus, I suppose, of our health system and of our the powers that be, as we refer to them, the pressures on the health services, 6% of presentations to emergency department directly related to over drinking, and 29% in the early hours of Sunday morning. That then feeds into road traffic collisions and road traffic mortality. In relation to birth defects, preventable birth defects and neurodevelopmental disorders, prenatal alcohol exposure is the leading cause of these. And in relation to fetal alcohol spectrum disorder, we have the third highest prevalence in the world in Ireland of, again, a preventable cause of significant disability. Alcohol-related liver disease, hospital admissions in Ireland now are the highest that they've ever been since the data has begun being recorded many decades ago. And alcohol-related overconsumption is involved in 50% of suicides. The stats also tell us that nearly 600,000 children are exposed to risk from parental alcohol use. So 600,000 children in a country the size of Ireland is, again, remarkable, being exposed to risk. Domestic sexual and gender-based violence, 34% of cases of domestic abuse are alcohol-related, and 50% of cases of sexual harassment. So I suppose what strikes me is that of all of the public health issues that we have in Ireland, very many of them are linked to harmful alcohol consumption. So we have the evidence. What do we do in terms of the action? I think when we're speaking to policymakers, certain ways of presenting that evidence have the most impact. We can present all of these harms, but what I suppose resonates is the overall impact on society in Ireland. The economic cost annually of harmful drinking is 3.7 billion. 1.2 billion of that is health care system cost, and roughly 1.2 on the justice system. So just looking at the healthcare cost of 1.2 billion, I think in terms of the return on investment of taking any action in relation to the alcohol-related harm, that's a no-brainer to me. And certainly we could do with 1.2 billion in the health services to invest in today. Just want to mention that in public health, we've just commenced the development of a HSE public health strategy, and many of the people in the room will be involved in the kind of coordination of that. But everybody has an opportunity to contribute or to submit. The email address is phstrategy@hse.ie. We want to develop that strategy over 6 months, very short window, because we need that sense of direction. This issue of alcohol-related harm will feature very highly in that. And the hope is that we would bring this, what I believe to be a crisis at the moment in Irish society, that we would bring that to the highest level of government for not alone action in relation to the evidence, but radical action. And I suppose we've seen from the COVID pandemic that when a significant harmful threat and exposure to Irish society is identified and communicated very clearly, then radical action is possible, cross-governmental radical action. I believe that's what's required now in relation to dealing with this crisis. So I hope you enjoy the day. I think it's a fabulous lineup, and thank you very much for the opportunity to speak.